Hello everyone. Let's today discuss about a topic that is gynecomastia, which is seen as basically it's seen as a sign in many of the cases. Now, what is actually gynecomastia? That is appearance or the enlargement of breast tissues in case of male. We know that in males we have a rudimentary breast tissue, but here in gynecomastia this is such a condition in which we see that breast tissue has appeared in the males. Okay, now we have to understand that breast development is mainly mediated by the hormone estrogen in females. Okay, but whenever there can be some problems that could be physiological, that can be pathological, so based on those problems we can identify that yes, there can be chances of gynecomastia in that male patient. Okay, so what is the first definition? You should know that male glandular breast tissue size that should be greater than 4 centimeter in diameter, and that tissue must be tender. Then only we can understand that yes, there can be chances of gynecomastia. But we have to follow certain clinical examinations which will actually help us diagnose better. Now see, we have to rule out one thing, that is cancer. We perform mammography and we check whether there is chances of cancer or not. Then coming on to the etiology or the causes, we know that there can be physiological causes, there can be pathological causes. So under physiological causes, if you see that in newborns, there can be higher levels of transplacental estrogen. Okay, when that particular male child is being delivered, that point of time the mother's hormone play an important role. Then we also have the transplacental higher levels of estrogen, which could result in that neonatal gynecomastia. Then in case of puberty, during puberty, when actually the hormonal levels are changing, that time sometimes might be the estrogen and androgen ratio. In case of males, generally it's basically less, the ratio is quite less. But in this case, in puberty, when the estrogen androgen ratio is quite high, there are chances of gynecomastia, because as I have already discussed, estrogen is that hormone responsible for development of the breast tissue. Now with aging also, one important factor is during aging the levels of testosterone in male body decreases, so automatically there are higher chances of aromatase enzyme activity, which converts this testosterone into estrogen, and then that estrogen actually results in increased breast tissue. Pathological causes, one of important things can be the androgen insensitivity, in which actually the androgen hormones which are secreted, they are not actually sensed by the cells. Then talking about in cases of certain tumors, like in case of testicular tumor, where there is the Leydig cell increased production of estrogen. Okay, Leydig cells generally produce testosterone, but there we see due to the tumor there is increased level of estrogen. Talking about in cases of obesity also, certain extent aromatase enzyme activity increases. One thing we can't rule out, that is the genetic defect. In cases of genetic defect, there can be some problems with this gene CYP19, and so there could be some chromosomal level problems for which the genetic defect can result into increased aromatase enzyme activity, which is actually mediated by this CYP19 gene. Then in case of certain drug actions, like certain estrogen substances which will actually stimulate estrogen production, like some oral contraceptive pills, or there can be the phytoestrogens, these can increase the level of estrogen. Other than that, there can be certain androgen inhibitory drugs like the ketoconazole administration, which can lead to excess amount of estrogen in the body. Or when there is the decreased amount of testosterone, that time the estrogen levels in the male body will dominate in that cases. If we talk about clinical examination, here we see that karyotyping is most importantly done, whether it can be in case of Klinefelter syndrome. We know that gynecomastia is a clinical feature, that is a sign that we generally see. Then we actually do the hormonal measurements, hormonal HCG, estrogen, testosterone, all these hormones are measured in the body. And also there can be certain problems with the liver, so liver function test, virilization assessment, all these things are done generally. Now talking about the treatment, here we see that in cases surgery is the best treatment, but at times surgery will be insufficient, because if there is painful gynecomastia, surgery cannot be performed. So in that cases we actually prefer the anti-estrogenic drugs like the tamoxifen 20 milligram, that is dose is given, which will actually help in reduction of pain, as well as the breast tissues size will also be reduced. And there are certain aromatase inhibitors like the anastrozole and the letrozole. These drugs can also be administered, but best drug which is seen over here in these cases are tamoxifen, which is generally used in cases of breast cancer. Also this drug is recommended. Okay, so that was gynecomastia, a very short topic, but here we come to know that yes, this is actually a sign as a result of certain other problems, like that could be related to drugs, that could be related to some other diseases. There can be these features seen in males, that is enlargement of the breast tissue. So that is gynecomastia can occur. So thanks everyone.